Because what we're seeing with the President's health care law, what we're seeing with the regulations that are coming out already, is an effort to do more of a one-size-fits-all decision-making process, where it becomes more and more cookbook, more and more formula-based, and less making decisions. And I don't care how fancy your computer systems are, I don't care how smart and how well different systems talk to each other, there are things you can never capture in those, and that's what we're really fighting to protect. Now, the health care law, I'm sure all of you agree with me that when the debate began in 2009, everyone agreed we do have huge problems in health care. We do. There are real access to care issues for segments of the population. And I was always amazed that all the polls on people who said health care was too expensive, and 89% of people said health care was too expensive. And I always felt like I'd love to meet the other 11%, because it is very, very expensive. And we were hoping that we could get reforms or things move in the right direction to improve access and cost. Unfortunately, the law, for those of us who were fighting it as it was going through, since you had groups like the AARP, like AHIP behind the scenes, like PhRMA behind the scenes, for all the good things that those groups do, they were just another rent-seeking group trying to get a piece of that $2.6 trillion a year pie. And frankly, they looked at you and your families as just pawns to move around, because you're worth money to them if you're in their piece. And our success, unfortunately, is in that we were absolutely right, because not only has the health care law not made things better, it's making things worse. And for every press story that you see coming out about how young people have greater access to their parents' insurance, well, part of that is because the president and the president's policies have created absolutely no jobs. So young people have no jobs. To seniors saving money on the donut hole. These are all coming at a significant price, and we're not talking about the price. For children-only health insurance, now at least 34 states, you can't buy a child-only policy. Even young adult individual policies are harder to come by. The costs of insurance are going up. That staying on your parents' insurance to age 26 increases the price of insurance by about 3%. Well, at current prices, that's an additional $450 per year. That's real money. It may not make a big difference in Washington or even at the State House, but to individual families with gas and food prices, it makes a real difference. So the important picture here is you all know the basics, otherwise you wouldn't be out here today. But I will summarize by saying 60 plus and the work that Jim has done and his team have done is pretty amazing. The voice that he can bring both through you directly and on your behalf to legislators of both parties to promote sustainable and quality health care services and other senior services that people have paid into their entire working lives. It's really the voice you need and you want. AARP makes about $600 million a year selling health insurance. You can't turn on a cable channel without seeing an AARP United Healthcare commercial, either hawking their supplement plan or their medication prescription drug plan. And 60 plus is an entirely different message. So being out here is the first step. You need to stay involved, stay on top of our elected officials. Obviously, there's a big national election coming up in November. And while I think the vast bulk of us would like to see somebody new in the White House, the job isn't done after November 6th if we win. The job really is just beginning, because holding the feet to the fire and holding them accountable for the policies they want to put forward, because they're going to be subject to the same multi-billion-dollar effort that's going on in Washington and every state house by the major players in healthcare, are things we need to fight. And we can have success if we continue to be successful. So talk to your family, get involved in 60 plus, get your neighbors and people at church and the organizations you belong with involved, because we all really need to fight together to ensure that health and healthcare decisions stay in the hands of patients and families and not politicians and their pals.